sister for taking the time to go through Abraham's care plan with me. It's been been really good meeting Abraham, and I just wanted to go through what my role is. Is that all right?
Yes, of course.
Okay. So I understand in relation to Abraham's communication needs, he wants me to help. He needs help with his hearing aid and with his cultural and spiritual needs. He needs help to ensure that his food is kosher, and he needs reminding to when to say his prayers and make sure he has a quiet place to say his prayers. Regarding recreation, I can help him by supporting him to transfer to a chair and wheel him out to a veranda, and just make sure he's got a hat on and he's got his sunscreen on, and make sure he's not sitting directly in the sun for too long, no more than 30 minutes outside in the sun. So he also likes listening to his radio and make sure that he can hear the easy listening station. That's his favourite. And to ensure that he's comfortable and make sure he can reach his feeding cup and that the spout is facing the right way, and that he can make sure he can reach it, and that his buzzer, he can reach his buzzer, and ensure that he has new books to read, and make sure he can reach his glasses. So that's with his recreation. With sensory, I can help him to ensure that his glasses are clean before he puts them on, and make sure that they're in reach of him when he's left alone. With his mobility, I need to be, I can assist him, take him on morning walks, so make sure he gets out using his walker when he can, or if he's not feeling well, help him use his wheelchair. So I also need to assist him moving with the hoist, and 2 staff members to help him into a chair. Regarding his personal hygiene, my role is just to make sure his privacy and dignity is maintained, and also make sure I'm always speaking with him about how I'm assisting him, and ensure that the water is warm in the basin and make sure it's not too hot. I need to use a soft washer and soap substitute to gently clean his skin. Also need to gently dry his skin with a soft towel, ensure it's thoroughly dried. He also needs help by putting a protective barrier cream on his skin, but don't rub it. Okay, regarding his oral care, just make sure he's sitting upright, and help him clean his teeth with a soft, small-headed toothbrush, and make sure he's got fluoride toothpaste. He also needs assistance to apply oral gel to his lips. Regarding his skin care, I can encourage him to move around and not stay in bed sitting on a chair or sitting in a chair for too long. Also need to inspect his skin for redness and report any documented if noticed changes in his skin condition. I also need to ensure his linen is free from wrinkles and is smooth, and when doing transfers, be careful not to pull or drag or knock on his skin. I also need to assist him to ensure his skin is clean and dry all the time, and that he has an air pressure ripple mattress on his bed. I also need to assist him with regular toileting to prevent him from becoming incontinent. So regarding his bowel function, so this is where I'm wondering, I think it's outside of my scope or outside of my job role, in just one part of it. So my role is to support and monitor his bowel motions and complete a bowel chart, and ensure that he's got a buzzer within reach if he needs to go to the toilet. But there's something in here regarding medication that I feel that's not in my job role. So this is where I want your advice in this area. So in this part of his care plan, it says if he hasn't had a bowel motion after the second day, give him an aberrant or a laxative every morning until he has a successful bowel motion. I think that part of the care plan needs to be revisited and changed, because that's outside of the scope of my role. I believe the nurse should be administering medication. However, I do think that I can encourage him to eat high fibre, soft diet as per the care plan, and help support him to maintain his fluid intake. So it's just that one bit there I think we need to, review in that area. So regarding his sleep, I can ensure, I need to support him by ensuring he's comfortable before he goes to sleep, and ensure the room is at comfortable temperature. Also, before he goes to sleep, ask Abraham before he settles to sleep, just to make sure he's comfortable, and reposition his pillows if needed, just how he likes it. So regarding his nutrition and hygiene, always support him to sit upright, and support him to eat a high nutrition soft diet. I also need to ensure he receives kosher meals because of his religious beliefs. So I need to record what he eats and drinks in a food diary for him, and if he feels unwell or refuses food, inform the registered nurse. Okay, so regarding his environment, I can help him with his personal care, ensure the room and water temperature is comfortable. Also need to ensure that he has warm clothing in cold weather and cool clothing in warm weather before he goes out on the veranda. I also need to ensure his bedroom is at an appropriate temperature. So that's the environment. So regarding his pain, this is another area where I think needs revisiting, because it's outside of my job role. The first part is okay, so report any and document if he experiences any pain. But here it's got on to administer pain relief medication as directed by my physician. This is the area. And again, administering medication is outside my scope. I believe the registered nurse should be administering medication. So can we revisit this one as well, this section? There are a couple of things that I think we could improve on Abraham's care plan. Just going back to his cultural and spiritual areas here. I think we can help him more in this area. I think we could contact the local rabbi and see if he actually does visits, and maybe we can work into his care plan to, have some sort of visitation with the rabbi. Whether we take him there or we need to, I think that would be a good idea. Now there also is a Jewish website, and Abraham has an iPad. And he seems to, be able to use that okay, but I think we could show him the Jewish website. Well, he may not be aware of it, but I think we could show him so he could look up and, read stories. There's also our Jewish community Facebook page that I had a look on there, and I think Abraham would enjoy it, because there's he could watch streaming services. They have special services, lighting of the candle, and I had a look at that. Was really interesting. So I believe we could improve his care plan in this area. Would that be okay to consider that? I mean, that's just an idea.
Yes, definitely.
There was another area that I think we could improve on also. I can't see anything in the care plan regarding his exercise or physical activity, and I think that's really important. So I've just drafted up and, something to consider and see what you think regarding his needs. I believe he needs to do some physical activity to help to combat the effects of aging, and his goal could be maintaining a level of fitness appropriate for his age. And how I can support him in this is just supporting him to do chair exercises as per a plan prepared by an exercise physiologist. So when he's feeling well enough, that is. So if we could consider maybe getting an exercise physiologist to come in and do an assessment on Abraham. You know, this is an area that maybe it might just improve his care plan. What do you think?
That's a great idea.
I'm looking forward to working with Abraham. Thanks for going through the care plan with me.
That's wonderful. You're doing a good job.
Nurse Smith.
Okay, it's check.
Check. Oh.
Okay.